detected yet. We're concerned that people are dismissing Omicron as mild. Surely, we have learned by now that we underestimate this virus at our peril.
So joining us now to talk more about this and answer all your COVID-19 questions is Dr. John Swartzberg from UC Berkeley School of Public Health. Dr. Swartzberg, thanks so much for coming back to Getting Answers.
Thank you for inviting me.
Well, you heard the WHO, the Director General there, saying we're underestimating Omicron. Is it a myth or not a myth that Omicron causes milder illnesses?
Well, we don't know the answer to that. There is some very, very preliminary data suggesting that it may be a little less severe in terms of the illness it causes compared to Delta. But that's very preliminary evidence. And I don't think we can count on that at this point. The bottom line is we know it can cause severe illness. And we know already from a report in the United Kingdom that it's caused at least one death.
All right. Well, look, if Omicron does turn out to be milder, would that also mean less likely to cause long COVID in people?
We have no idea. We know that people can get long COVID after having a very mild episode of COVID. So there's nothing to suggest that Omicron is going to make it less likely that you would get long COVID.
All right. What about this? Hearing that Omicron may be running out of steam in South Africa, where it's believed to have originated. Any truth to that?
Not yet. Much too soon to tell. There's been some encouraging data out of South Africa in terms of who's being hospitalized, and the number of people being hospitalized hasn't risen proportionate to the number of cases that have occurred. But South Africa is a very different place than the United States or much of the rest of the world in terms of it has a much younger population, for example, and a younger population is much less likely to be hospitalized. Yeah, let's just not count on Omicron being a benign entity.
Yeah, the demographics there certainly are different from the demographics here, so we don't have enough information. But are there any preliminary signs that Omicron may be starting to rival Delta here, or still not even close?
No, there are some preliminary signs. We know that last week there was reported as a 0% isolation of Omicron here. Now, there were some isolates, but when you round it, it essentially is a rounding number to zero. So essentially last week we were all the virus we were seeing here that was causing disease was Delta. This week it's 3%. Now that doesn't sound like a big number, 3%, but in 1 week going from just a touch over 0% to 3%, and if you just geometrically project that out, within 4 or 5 weeks, you're going to be talking about half the isolates here will be Omicron. And within 10 weeks, if it continues like that, Omicron is going to be the gorilla in the room.
All right. Well, look, fearing that, not knowing which direction that will take, and also just seeing a 47% increase in cases since Thanksgiving here in California. The Health and Human Services Secretary, Dr. Mark Ghaly, just announced that the universal state indoor masking rule is coming back for 1 month, starting tomorrow through January 15th for everybody. This is for vaccinated and unvaccinated folks. I'd like to ask you who you think this will actually impact.
Well, it's going to impact all of us because we know that masking prevents, or at least does a good job in preventing the spread of this virus. There's a plethora of scientific evidence to support that. So if people do mask, and indoors is so much riskier than outdoors, if people are masking indoors, it's going to decrease the transmission of this virus, which makes everybody safer.
Dr. Mark Ghaly agrees with you, certainly. He said even a 10% increase in indoor masking can reduce case transmission significantly. But others, like Solano County's public health officer, says the numbers don't actually show a mask mandate leads to a directional change in cases. How do you respond to that?
Well, there's a lot of science to support the observation that masking does decrease the transmission. And we know people aren't masking indoors where transmission is very likely to occur. So it would seem logical that if we can get more people to mask indoors, we'll have a decreased transmission.
Are you saying,
so I would say I disagree with that health officer.
So if he points to a couple cities within Solano County that have their own indoor mask mandates, whereas the whole county didn't have one, would you say, and he points out that those cities actually had higher case rates or more transmission, would you say that's just anecdotal?
I would say that's anecdotal. Having a mask mandate and then enforcing that mask mandate are two different things. For example, I love watching the Warriors play basketball. And when I watch them play at home, they often pan on the audience there. And I would say when I'm looking at the audience in San Francisco at the Warriors pavilion there, I'd say maybe 50% of people have masks on. And I see people with the masks on under their nose or on their chin where it's not doing any good at all. So, having a mask mandate and actually having people respond to that and wearing a mask are two different things.
Mm-hmm. All right. I want to get to, questions about vaccines and boosters and treatment. Beginning with this is kind of a big deal today. Final study is out on the new Pfizer pill. It shows the treatment is effective, right? How effective?
Yeah, Paxlovid is the name they're using for it, and it's very exciting. Now, the caveat, of course, is this is data released by the company, and the company, of course, has a vested interest in promoting their product. And it will be very thoroughly scrutinized by independent scientists. But that hasn't happened yet. So this information is coming from Pfizer. If it is true, and there's every reason to think it will be, if it is true, what their data is showing is that if you are exposed to the virus, you get infected with the virus, and you get symptomatic, develop a cough, fever, etc., and you take this medication within 72 hours, it's going to prevent you from developing serious disease, hospitalization, and death by close to 90%. It was 89% according to Pfizer. If you take it within 5 days, it's going to reduce it to 88%. So essentially the same. So it's going to give a tremendous amount of protection. So if this turns out to be the case, and we have this medication available to all of us, which is going to take a while for them to ramp that up. But if that's the case, and if you're fully vaccinated and boosted, where now you have a pretty good protection against Omicron to start with, and you have in your back pocket the possibility of having that pill in case you have a breakthrough infection, we're going to have a great deal of protection. And worldwide, this could be terribly important for people who can't get vaccinated around the planet.
When do you think it'll come out?
I think that we'll see the FDA address this issue by their advisory committee, maybe as soon as the end of this month, maybe before the first of the year. Then the advisory committee, from there it'll go to the FDA if the advisory committee recommends it. And we could see the FDA approve it by right after the first of the year would be a possibility. That would be maybe a little fast, but we could see that.
Okay, could be a big help. Now I want to talk about the Pfizer vaccine versus Omicron. Some study out on that too, and it seems like there's a big difference between 2 and 3 shots. Can you talk about that?
Big difference, yeah. If you've been fully vaccinated, which is 2 jabs now of one of the mRNA vaccines, Pfizer or Moderna, against Omicron, it's giving 30-40% protection against serious disease. It's still better than nothing. 30% is better than nothing, but it's not where we'd like it to be. But that's the bad news. The good news is that if you get a booster, it brings it up to 70 to 80% protection, which is just about where we are with Delta. So if you're fully vaccinated and a candidate for the booster, please get it.
Okay. Dr. Swartzberg, don't go away. We'll take a short break on the air. When we come back, we'll have more discussions, including Kroger making an interesting announcement today with regard to the unvaccinated employees and insurance coverage. We'll be right back.
In commercial break.
All right, Dr. Swartzberg, maybe we can do some viewer questions just on Facebook Live right now as we take a short commercial break on air. Dawn has a question here saying, is it strange that health officials say we don't know whether Omicron is milder, yet in the same breath they say the booster will help against? I see that question a lot, so perhaps you can address it.
Sure. It takes a while to figure out how how sick it's going to make people, because from the time you get infected to the time you get hospitalized is on average about 2 weeks. But from the time we get the data, it's often 3 to 4 weeks. So hospitalizations, people getting really sick and winding up in the hospital, there's a lag time between 3 and 4 weeks of getting the data. So that means that it's going to take us probably another couple weeks at the minimum to really have enough data to say how sick Omicron is making people compared to Delta.
All right. Heather says it's more of a comment, but I like to get your take on it. She says this COVID virus keeps mutating and we don't know what is coming after Omicron. I believe that due to this, we may mask wear long into next year and the year after. We need to vaccinate everyone. What do you think?
1 minute.
I agree with her. I think she's absolutely right. The reason variants occur is because there are people who don't have immunity to this virus, where the virus can produce billions of progeny. And when it's producing billions more virus, some of those are going to be variants. And some of those variants are going to be able to survive well, even better. And that's what we see with Omicron. That's where it came from. So we've got to get not just Americans vaccinated, but we've got to get everybody in the world vaccinated.
All right. We are coming back in about 20 seconds, so here's your chance for a water break. Dr. Swartzberg, thanks so much. I'm taking mine. Hopefully there's enough time. All right. I think we did it. 9 seconds.
7.
Let's start with Kroger, you guys, the Kroger chain.
3, 2, 1.
We're back with Dr. John Swartzberg from UC Berkeley discussing the latest pandemic headlines. This one making news today, Kroger, that's the grocery chain. They're going to do something. So they're going to put on a new $50 health insurance surcharge for unvaccinated employees, and they won't provide some benefits like paid leave if they get sick from COVID. This seems new. What are your thoughts on this?
Well, we've seen other companies, for example, Delta Airlines, charge a premium on people's insurance if they're not vaccinated. So this is a concept that it's another way to try and get people vaccinated. And I think it's unfortunately necessary for companies to be doing something like this. You know, what Kroger is essentially saying is that they want their employees to be safe, and they want the people around their employees to be safe. So they're doing everything they can to get their workers vaccinated. I think they're right.
All right. Something new also that I'm noticing is that MIT, that's Massachusetts Institute of Technology, is requiring its community to be boosted come mid-January or they'll lose access. Also, I'm reading the NFL is requiring boosters of coaches and staff, though not players. So it seems like this is becoming the norm to require the 3. Do you think that's a good idea?
I do. You know, based upon what we were talking about earlier in terms of how much better a booster gives our immune system protection, gives us protection against Omicron, and we know Omicron is going to be taking off, I think it makes sense that we have to start thinking about a regimen of vaccine being a 3-dose regimen as opposed to a 2-dose regimen. So I think we're going to see boosters being the criteria for being fully vaccinated.
Okay. Look, this year under President Biden, America has lost just as many lives as we lost last year under former President Trump. I'm definitely not asking you to wade into politics, but I'm asking what factors could have shaped that outcome, given, you know, that this administration has signaled a more serious approach to the pandemic and, of course, the availability of vaccines.
Right. Well, part of the problem, of course, was that when the new administration took over, it took a long time, appropriate amount of time, 3 months or so, to really get anything moving. And then, of course, once we got things much better in this country, Delta came along, and that just was a tremendous shock to the system in terms of number of cases and, tragically, the number of hospitalizations and death. So we've had a couple of major problems this year, but in no way I don't think anybody should take home the message that, well, vaccines didn't protect. Or that masking doesn't protect or social distancing doesn't work. All these things really work, but we have to put them all together.
Right. Look, are you still worried when putting it all together about a potential twin-demic this winter, COVID and flu surges at the same time?
Well, I worry about I don't know the name for it, but a tridemic,
Oh.
if you will. So right now, what's causing most of the disease, almost all the disease in the United States, is Delta. That's going to continue, and it's going to continue to grow. Earlier, you said it was 47% increase since Thanksgiving. It's over 50% actually now.
Wow.
So we've got Delta to deal with. And then on top of that, it's pretty apparent that Omicron is going to be a problem for us. So we've got Delta plus Omicron. There's your twin-demic. And then the tridemic, if you will be influenza on top of that. We saw a big outbreak at the University of Michigan, and we saw an outbreak in the University of Wisconsin and some other universities. So I think that of influenza, excuse me. So I think that there's the possibility that we will have a typical influenza year this year. You know, last year we had essentially no influenza. We were blessed,
right.
And that's really rare. So we could have Omicron, Delta, and influenza, and that's going to be putting a lot of pressure under our healthcare system.
All right. Well, these are important times to take precautions. Professor John Swartzberg, clinical professor emeritus at UC Berkeley School of Public Health, thank you so much for your time. Appreciate it.
Thank you very much.
All right, don't go away, because coming up next, we're going to talk about something very interesting. We're going to talk about really focusing on reporting on the Chinatown community of San Francisco. We will talk to a reporter with the San Francisco Standard, an organization that shares ABC7 News' mission to build a better Bay Area, when we come back.
In commercial break.
Okay. Thank you, everybody. Good questions. Good questions today. Good involvement. All right, we'll take a short break. We'll be right back. Welcome back. ABC7 is excited to announce a partnership with the brand new San Francisco Standard to showcase some of their deep and insightful reporting on the city. Our news organizations share the mission of building a better Bay Area, and one important piece of that is to tell the stories, the successes and struggles of all our diverse communities. And that includes the often overlooked Asian American community in San Francisco. Joining us now is San Francisco Standard reporter Han Lee, who will be covering unique stories about Chinese Americans in Chinatown, the Sunset District, and throughout the city. Han, welcome to the show.
Hi, Kristen. Thank you for having me.
Absolutely. Good to see you again. You're new to the San Francisco Standard, but you're definitely not new to covering the Chinese American community in the city. Tell us a little bit about you before I do.
Yeah, thank you. I love storytelling, and as a Chinese immigrant, I speak fluent Chinese, both Mandarin and Cantonese. So that language skill would allow me to speak directly to a lot of immigrant community members. So I would understand their struggle, their happiness, and their successful stories. And for a long time, I think those stories have been ignored. So I would love to bring those to light. And of course, Chinese community is about 1/3 of the city's population. So they're a significant part of our community. And I do think that's important stories, and I would love to continue to tell them.
No doubt you will. I know you were born in China and you came here, went to USC, worked at the World Journal, a respected Chinese language newspaper where I've run into you on stories, and great to see you now at the SF Standard. I want to ask you why you think the Standard, as an English language, hyper-local news outlet, really wants to have a reporter who speaks fluent Chinese, Cantonese, and knows Chinese and Chinese-American culture and history and all the players here.
Yeah, thank you for that question. I do think San Francisco is the best city for a Chinese reporter to tell the Chinese American stories. So not only because the city has a long history of Chinese immigration, and now we have 1/3 of the city's population, and also just look at the Chinese community now in Chinatown or in the other neighborhoods. The culture events there, like the iconic Chinatown Lunar New Year Parade and the Mid-Autumn Festival, and also the community organizing and the political influence. It's just fascinating, and there are a lot of stories to be told. So I do think I can tell the stories in the English language to a broader audiences, and that would be great.
Yeah, a lot of celebrations, stories of perseverance, but also sadly a lot of break-ins to the local small businesses in Chinatown. I know you've been all over those stories as well. But look, your first story for the San Francisco Standard went live last week, and it's about Muni restoring 2 express bus lines serving Chinatown. Tell us about that.
Yeah, so as you might know, during the pandemic, San Francisco's transportation agency, SFMTA, they suspended a lot of bus services because the ridership declined and a lot of people are working from home. But also working from home might be some luxury to a lot of working class family. You know, they're living in the southeastern part of the city. They have to go travel to downtown or Chinatown area, working in the service industry and the nonprofit industry. So a public transit option is very critical for them. And both the Chinatown community and also the Chinese community in the southeastern part of the city, they were advocating for the return of the express bus lines. So they reached out to the transportation agency, the board of directors, and also the elected official. So the MTA decided to bring those bus lines back, connecting Chinatown and connecting Chinatown and also Visitation Valley. And I do think this is a good example of the immigrant community getting engaged in city's politics and asking for more resources.
All right, there's definitely an advocacy angle there. That's a great story to put out. You also tweeted last week about the promotion of someone totally homegrown to the position of San Francisco Police Commander. Tell us about the significance there.
Yeah, you know, Asian American in the city's politics, we cover the representation a lot. So Paul Yep, who is a Chinatown native, who was promoted to be SFPD's commander, which is a really high-level management position. And just like a lot more Asian American in the city's politics, this kind of Asian American representation is one of our focus too. Just like in 2021, we have our first Asian American city attorney, David Chu, and also our first Asian American female city administrator, Carmen Chu.
Exactly. I mean, you've got to have police that the community can relate to, right? And having someone at the command level, that is very important as well. Also, I know you're working on a lot of other stories for the San Francisco Standard, focusing on the Chinatown community. And one that I cannot wait to see is about a chef with a big heart. I know you've been covering him for a long time. Tell us about that story.
So yes, you know, Bay Area has a lot of immigrants, and all the immigrants are doing their part together, building a better Bay Area. So every Christmas I will go cover an event in Tenderloin. It's happening at the Glide Church. It's a Christmas meal lunchbox event. So they will prepare hundreds of lunchbox for the most vulnerable in San Francisco. And the one cooking these meals is an immigrant from Hong Kong. So every Christmas, he will get up at 4 a.m. in the morning and travel to Tenderloin and starting preparing those meals to the most vulnerable in the city. And he has been doing this for over 10 years. How amazing is that?
That is really amazing. I personally just love the stories about building bridges through food, and I think that's it. All right. Also, I should mention that you recently did another story about David Campos. This is the Assembly 17 race, falling short in his bid for the state party endorsement. That was, I think you were first to report that, so congratulations on that. But good stuff. So we can find all your stories together in one place. Where?
sfstandard.com.
All right. Han Lee, always great to see you. I guess I should tell people that we've known each other for a few years, and you have a nickname for me.
Yes. Oh, what is that? I don't know.
Oh, no, you were going to call me Shi Jie.
Yes, yes. 谢谢师姐姐, yes.
All right, that means Z,
谢谢邀
sister,
请,
right?
Thank you.
Yeah,
Yes.
I said, Han, sure, you can call me that. Just don't call me Shi Po Po, which would be grandma.
Oh, no, you're not. Yeah, thank you. 谢谢邀请, 谢谢师姐姐.
不客气, 不客气. It's amazing to see your work and see how it's grown and contributing to the effort of building a better Bay Area through the San Francisco Standard and ABC7 News. Han, good luck to you. Looking forward to all your stories.
Thank you, Kristen.
And again, we want to let our viewers know that this is a new partnership that we have with the San Francisco Standard because we share that mission to build a better Bay Area. So the San Francisco Standard's deep and insightful reporting is something we are going to feature here on ABC7 as well. We do have links to the San Francisco Standard's other original reporting on our website, abc7news.com, and you can watch more of their videos as well. We'll be right back.
In commercial break. We are back in 10, 9, 8, 7, 6, 5 seconds, 4, 3, 2, 1.
Thank you so much for joining us on Getting Answers. We'll be here every weekday at 3 on air and on live stream answering your questions. Bye-bye.